Now we're going to discuss what the patient's role in the adjusting process is. This all depends upon, of course, which type of technique your chiropractor does use. If it's an instrument, it's going to be different. If different types of manual techniques require different patient positions or participation. For the sake of today, we're going to basically deal with a couple different styles of diversified adjusting. And for the neck adjustment and for the thoracic or mid-back adjustment, patient is going to be laying face up in the what we call the supine position. Okay. Really, the major goal for any patient in any time of getting adjusted is for them just to relax as best as they possibly can. The more relaxed they are, the more relaxed the spine is, and the more easily the joints are going to move. If they're tense, if they're rigid, if they're hesitant and fighting back, then it's a lot more difficult, and sometimes pain starts to come in that way. When they're more relaxed, we're usually not going to experience pain with the adjustment. For the neck adjustment, basically the patient is going to be lying just like this, completely relaxed. Usually hands are going to be over the stomach. If they're feeling a little more anxious, we might have them bend their knees. Bring both knees up, and this is just going to take a little bit extra stress off the back and just have them relax there as well. In terms of the thoracic adjustment that we're going to do, it's what we call an anterior adjustment. And basically we're going to be approaching it from anterior to posterior to make the adjustment happen. In this case, typically, the patient will have their legs extended again and relaxed. And what they're going to typically do is give themselves a big hug in this kind of position, just hold real tight. Again, this is going to separate out their shoulder blades and just get us a little more room to work with in terms of that mid-back and getting those joints kind of more in a position to receive the adjustments.